Ever wondered why some couples struggle to conceive naturally? Conception is a delicate dance between a woman's egg and a man's sperm. It requires precise timing, ideal conditions, and a bit of luck. However, a multitude of factors can interfere with this process. From hormonal imbalances to structural issues with the reproductive system, these challenges can make conception difficult for both women and men. For those who face such challenges, in vitro fertilization, or IVF, offers a promising solution. So, what exactly is in vitro fertilization and how does it work? In vitro fertilization, or IVF, is a form of assisted reproductive technology that involves fertilizing an egg outside of the body and then transferring it back into the uterus. It's a meticulously planned and executed three-step process: egg retrieval, fertilization, and embryo transfer. First, eggs are harvested from the ovaries in a procedure known as follicle aspiration. This is done using a needle guided by ultrasound through the vaginal wall. Once the eggs are retrieved, they're ready for the next step, fertilization. In the lab, the collected eggs are introduced to sperm, which can either be from a partner or a donor. This is where the magic happens. The sperm and egg meet and fertilization occurs. The fertilized eggs, now embryos, are carefully monitored over several days. The final step is the embryo transfer. One or more embryos are inserted into the uterus using a catheter. This provides a controlled environment that can increase the chances of successful conception. While the process might sound complex, every step is meticulously planned and executed. Let's delve deeper into the step-by-step journey of IVF. Imagine embarking on an adventure with the goal being the creation of life. The journey begins with the administration of fertility medication. This is to stimulate the ovaries to produce multiple mature eggs rather than the single egg typically released during the menstrual cycle. The objective here is to increase the chances of successful fertilization. The next step is egg retrieval, also known as follicle aspiration. Under the watchful eyes of medical professionals, a needle is carefully inserted through the vaginal wall to the ovaries. Guided by the precision of ultrasound, the mature eggs are gently aspirated and collected. Once the eggs are safely gathered, they are whisked away to a laboratory, the stage set for the next act of this journey. Here they meet the sperm, either from a partner or a donor. The meeting can occur in two ways: insemination, where the sperm and eggs are placed together and allowed to fertilize naturally, or intracytoplasmic sperm injection, where a single sperm is directly injected into each egg. Following fertilization, the eggs, now transformed into embryos, are monitored for several days. This is a crucial period, a time of anticipation and hope. The healthiest and most viable embryos are selected for the final act of this journey: the transfer. Embryo transfer is a delicate process. One or more embryos are gently inserted into the uterus using a thin catheter. This is the moment when the potential life takes its first step towards becoming a reality, finding its home in the welcoming environment of the uterus. After the transfer, there is a brief period of rest. This is not the end of the journey, rather a pause, a moment to breathe and hope. The unused embryos may be frozen, a promise for future attempts if needed. Finally, the moment of truth arrives. A pregnancy test is conducted to confirm if the journey was successful, if the intricate dance of science and nature resulted in the miracle of life. After the embryo transfer, a pregnancy test will confirm if the procedure was successful. IVF is more than just a medical procedure, it's a beacon of hope for many. This revolutionary process offers a lifeline to those grappling with various forms of infertility, enabling conception where it might have seemed impossible. With IVF, the use of donor eggs or sperm becomes an option, broadening the horizons of possibility. Additionally, the ability to freeze embryos for future use provides flexibility and security. For many, IVF provides a path to parenthood that might not have been possible otherwise.